Okay, ladies and gentlemen, we're going on to our next PowerPoint, Careers in Healthcare. And we're going to start out with healthcare administrators. They are the folks that are the CEOs and executives in our hospitals or at large medical clinics. And their job is to plan, direct, and supervise the delivery of healthcare. We need to make sure that policies are in place, that protocols are being followed, and they're the ones that create those policies and protocols. So they manage the facilities, they hire personnel, they hire, whether it be the doctors, the nurses, the medical records staff, whoever, they hire personnel, they manage budgets and finances. We don't like to think about it, but healthcare is a business. It is an industry that, you have to make money to be able to pay the people that are working for you. So they've got to make sure that those budgets and finances are taken care of. And again, they do the policies and procedures for each facility. Now, a central sterile supply technician or central supply technician, they typically sterilize instruments. They usually work in the operating room or near the operating room because that's where most of your sterile supplies are used, in the operating room. So their job is to clean and sterilize those instruments that are used in surgeries or even procedures on the units at the hospital to make sure that they are clean and ready for the next patient. They can also order and maintain equipment and supplies, but typically their job is to sterilize instruments and ensure that they are ready for the next patient. Now, a physician, a medical doctor, a physician, those are the same things. Their job is to diagnose patients to find out what is wrong with them. They examine them. They find out what's wrong with them. They diagnose them. They can order tests. They can perform surgeries. They treat diseases and disorders. So there are different types of medical doctors. So you can have a medical doctor, which is MD behind his name or her name. You can have a doctor of osteopathy. That doctor, the DO, and the MD are exactly the same. They have the same training, the same education, but that doctor of osteopathy, their beginning program emphasized more on the whole person approach to treatment and care versus just, your blood pressure's up, we're going to give you a pill. It could be that they're focusing more on your mental health, because it may be that your mental health is causing your blood pressure to be elevated. So a doctor of osteopathy and a medical doctor are the same education-wise, but the doctor of osteopathy believes in that whole holistic person approach, okay? So doctor of podiatry or DPM, their focus is on a patient's feet, and the people that use podiatrists more often than anybody else is diabetic patients, because diabetic patients have lots of circulation problems, lots of neuropathy trouble. So they have a lot of trouble with their feet. So they're big customers of podiatry. Then we have a doctor of chiropractic or DC, and that's when you're talking about a chiropractor, and they make sure that your spine is properly aligned. They're the ones that you go to and they can crack your back and pop and crack and make sure everything's in proper alignment. Feels pretty dang good too. Now, there are physician specialties that physicians can go into, and we're not going to go into all of these. I'm just going to kind of read through some of them. Medical terminology will help you understand what these are. So ologist just means a specialist in that area. So if you're thinking cardiologist, that's a specialist in the heart. Pathologist, we've already talked about, studies diseases. Psychiatry studies the mind. So you can go through all of those and just get a glance at which ones are more interesting than others. You may be interested in one. A physician's assistant, a PA. They typically have a bachelor's degree, and then they go through a PA, physician assistant program, which is another 2 years. So if you think about it, that's about 6 years for a physician's assistant. Now, that physician's assistant can do exams, they can treat you, they can write prescriptions, but they do have to work under the direct supervision of a medical doctor. Medical assistant is a 2-year program, and they're not a nurse, but they do learn nursing skills to help in a medical office. Typically, the medical assistant will work in a medical office. It's a 2-year certificate program, and that person can learn how to do some nursing duties as well as office duties like filing insurance, making appointments, billing issues, things like that. So they kind of do both of those, some nursing issues or duties and some front desk clerical staff duties. Now, we just mentioned earlier in a PowerPoint the surgical technician. It's a 2-year degree program, usually from somewhere like LCC, James Brunt, any community college. I don't think James Brunt offers surgical technician, but what that surgical technician will be in the operating room with that surgeon and assist with the surgery. They pass instruments to the surgeon. They can assist with that surgery. So the psychiatrist is a medical doctor, just like the cardiologist, just like the radiologist, the pathologist. That psychiatrist just specialized in psychiatry. So they treat and diagnose mental disorders like diseases of your mind, anxiety, depression, schizophrenia, okay? And they can actually specialize in different areas, but the psychiatrist is a medical doctor just like your family doctor, but they have specialized in psychiatry. A psychologist is someone with a bachelor's or master's degree, and they study human behavior, they do counseling, and they can specialize in different areas as well. But the psychologist has a master's or bachelor's degree. The psychiatrist is the one that can write prescriptions, and they have a medical degree. Now, a social worker is usually a bachelor's or master's degree, and they help people cope with problems, and I have misspelled cope. So they're a social worker. They actually talk to patients and try to help people work through their problems. Now, we're talking about skills, more skills. So the hand washing skill we need for you to go over. We're going to, first of all, adjust the temperature of your water to nice and warm. You do not want it cold, and you do not want it hot. So you're going to wet your wrist and your hands, and you're going to keep your fingertips pointed downward, because if you've got dirty water on your hands and it runs up your arm towards your elbow because you hold your hands up in the air, then that's taking that bacteria and stuff further down your arm. So you don't want to do that. So you're going to keep your fingertips pointed downward and keep them lower than your elbows. You're going to apply soap using friction. You're going to make sure that you're cleaning in between each of your fingers, around your fingernails, under your fingernails. Okay, and you're going to have a good lather to usually about 2 inches above your wrist. You're going to wash for a minimum of 20 seconds. That's the minimum, okay? And that is a test question. You're going to rinse your hands well. Again, still keeping those fingers turned downward. You're going to dry your hands with a clean paper towel. Make sure that you have got the paper towel, mash the button or whatever you got to do if you have to touch anything before you wash your hands, because you don't want to touch a dirty button to try to release those paper towels. So you're going to dry your hands with a dry paper towel. Then once you're done, throw that away. And then you're going to take a dry paper towel, another clean dry paper towel, and turn the water off, because you don't want to turn the water off with your clean hands, because you just touched that faucet with your dirty hands. So that would defeat the purpose of cleaning your hands. Now, we're going to do a skill on apical pulse. Now, an apical pulse, if you look at this picture right here, it actually shows where the apex of your heart is. It's right up under your left breast. Okay, so as for the procedure, you're going to wash your hands. Anything you do, guys, you're going to wash your hands. You're going to identify yourself to your patient, tell them what you're going to do. So your stethoscope is the instrument that you use to listen to that heart rate. Now, you can listen to other things with a stethoscope. You can listen to breath sounds, heart rate, bowel sounds. You can listen to so much stuff with a stethoscope. So, of course, you're going to clean those earpieces, because you don't want somebody else's ear gunk on those earpieces and then you put them in your ears. So clean your earpieces, and also clean the bell, the end of the stethoscope that you're going to touch your patient with. Now you're going to locate the apex of your heart, and I've got it drawn right there on that picture. And you're going to place the bell or the end of that stethoscope right up under that left breast. That's where the apex is. That's where you hear that apical pulse the best. And you're going to count that for 1 full minute. You're going to note any abnormalities if it's kind of irregular, if you hear that it's skipping a beat, because the heart rate should always be lub-dub, 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 lub-dub. And if it's not like that, we need to know that. If it's an irregular heartbeat or if it skips a beat, we need to know. You're going to chart that in that patient's chart. You're going to clean those earpieces and, of course, wash your hands. And I'm going to show you, or actually, this next slide is measuring and recording an apical pulse. That is sounds that you can hear. And I'm going to try to add that to your YouTube video, okay? I don't know if you can open it from here or not. If you can, great. If not, I'm going to try to add it somewhere else. Now, on to other careers in healthcare. A dietitian. The dietitian is the one that manages the food services, like in a hospital. They're going to manage the kitchen in that hospital, how the food is prepared, because there's so many different diets that people are on in a hospital. You know, it's not just like, oh, I'll cook something and give it to the patients. Some patients are on a low-fat diet. Some patients are on the American Heart Association diet because they're having heart issues. Some people are on American Diabetic Association, the ADA diet, because they need a diet that is low in sugar. So that dietitian is going to assess those patient needs to find out what type of a diet they need. They're going to plan menus for each diet that patients need in the hospital. And dietitians do a lot of teaching patients about their nutrition. Your diabetic patient needs to realize that carbohydrates, when they're broken down, turn into sugar. So if your diabetic patient is eating a lot of bread, rice, pasta, potatoes, that's going to increase their sugar levels. So people may not realize that carbohydrates, when they're digested, turn into sugar. So that's what that dietitian does. They're going to do a lot of education with their patients. A dietetic assistant works under that supervision of the dietitian, and they usually assist in preparing food, or they can actually take trays up to the floors and, deliver meal trays to patients. But they work under the supervision of that dietitian. Now, when we talk about feeding a patient, you have to know some skills. And you think, oh my gosh, it's just feeding somebody, but it really is not. Of course, you're always going to wash your hands, and you're going to use universal precautions. If your patient, because contaminated body fluids is not just blood, it can be saliva as well. So a lot of people wear gloves because they're going to come in contact with the patient's mouth. You're going to position your patient upright, of course, because if you're eating, you're going to be sitting up. You're not going to be laid back in the bed eating. You're going to prepare their food, make sure it's not too hot for them, that it's cut up well for them. Now, with all of that being said, if your patient is able to do anything on their own, you need to allow them to do that. So, allow your patient to do as much as they can for themselves, okay? People need to stay as independent as they possibly can. But if they need assistance because maybe they have Parkinson's disease and their hands shake terribly and they're trying to feed themselves and they're spilling their food all over themselves, then you help them, okay? You help them if they need it, but allow them to do as much as they can for themselves. If your patient is blind, blind people can eat on their own, but you kind of have to let them know what they're eating and where it's placed at on their plate, okay? Excuse me. And I am about to the end of this PowerPoint, this section of this PowerPoint, so I'm going to have to start on a different section, okay? So I will be back with part 2.